Today our webinar is on supporting children with diabetes, taking part in extracurricular activities with less worry. We're going to be reviewing tips to keeping your child safe and prepared while enjoying after-school activities. My name is Janice Baker. I'm a registered dietitian, certified diabetes educator, certified nutrition support clinician, and board certified in advanced diabetes management. I've been in practice for 35 years, working not only with people with diabetes, but many other nutrition and health issues. I have 3 children of my own I've brought up that are all young adults now. And I actually have a background in working at camps with children with diabetes. This was back in 1982 when we actually had very little in the way of technology. We didn't have meters, we didn't have CGMs. We had old insulins that we really didn't know too well what their rate of action was, so it was quite unpredictable. But nevertheless, that was one of the most influential times of my career, and I saw firsthand how great it was to have these kids with diabetes be together with their peers, have fun, and I think they taught me more than I could ever imagine. So again, that was back in 1982 with minimal amounts of technology, very little knowledge compared to now about what we know about diabetes, but it was one of the best times of my career. And I'm pleased to present today some more information on how to support your child with the activities and the extracurricular activities. So we want to plan for fun and experiences. Diabetes should not prevent your child or teen from enjoying special events, slumber parties, after-school activities, or sports. We'll be discussing ways to prepare if your child is not going to be in your care. The takeaways today are to help parents and caregivers ensure that children and teens with diabetes have a chance to fully and safely participate in extracurricular activities, including sports, field trips, clubs, and camps. We want to help them plan for longer school days with before and after care or tutoring programs at school. And we're going to review legal rights and supportive resources. If a trip is planned, such as a school camp, it's a good idea to have your child visit with a doctor and to ask about having on hand written prescriptions for insulin and other medications in case of loss or damage. A physician letter describing supplies needed for treatment, including medical devices, and a note of any food or medication allergies or sensitivities. Confirm and communicate with the supervising adult or adults assisting with diabetes management, such as glucose checks, injections, etc., and in case of high or low blood sugar. These can occur at unpredictable times during outings because of change in activity, food intake, other circumstances that may be involved. So again, review signs or symptoms because again, every child is different. Even have these written down ahead of time, which often is the case, especially in longer duration activities such as camps. So again, spend time with the adult to teach your child's unique signs and symptoms of high and low blood sugar level, and remind your child as well to communicate with supervising adults what may be occurring if they are understanding that their blood sugars are getting out of range. So again, other points to review include blood sugar check techniques, routine, and reviewing of CGM data, reviewing carbohydrate counting and or typical meal plans, measure and give insulin, and if on a pump, also review pen or vial and syringe backups just in case of a pump malfunction, review treatments for high and low blood sugar levels, account for weather and even altitude changes in technology, glucose levels, and account for clothing. Consider easy access to quick-acting glucose when outdoors, whether it be up in the mountains in the snow or at a beach. Have on hand easy access for your child waterproof packs where they can quickly get to glucose tablets, gels, or gummy bears. Responding to an emergency, including use of glucagon kits. Now, glucagon kits, again, are to be used when one cannot take by mouth quick-acting glucose gels, tablets, or even juice or soda. This is when there is lack of responsiveness. So the glucagon kit, which is an injection, should be part of the plan and should be part of any emergency kit for somebody who is using insulin. Create a basic menu with your child and adult in charge to plan around meals, snacks, and insulin doses ahead of time. Plan also for flexibility, changes, and additions. Remember again, extracurricular activities may often have including special foods, fun foods, special events, birthday parties, and we want to account for those special foods and meals so your child can participate. So in packing, we want to pack twice the amount of supplies you think you may need just in case of damage or loss. And these supplies include insulin, syringes, blood sugar testing supplies, pump and/or continuous glucose monitoring supplies, ketone strips, glucagon kit, glucose tablets or fast-acting sugar to treat low blood sugar levels, a medical ID card, and also consider your child should always wear a medical ID bracelet or necklace, as well as having this information on a cell phone, day and night phone numbers for your diabetes medical team, contact numbers for any emergency contacts, batteries for flashlights, pumps, and meters, snacks like peanut butter and crackers, milk or juice boxes, trail mix packets, first aid kits, anti-diarrhea pills, and anti-nausea drugs. Again, like any other medications, either prescription or over-the-counter, these medications should be listed on any forms or given to the supervising adult for appropriate use. So other essential issues include, before a class trip or activity, remind the teacher or supervising adults that your child will need snacks and a water bottle, including the fast-acting glucose supplies in case of hypoglycemia. Identify where closest bathrooms are located. Provide an action plan and instructions for treatment from mild to severe low blood sugar. Review appropriate glucose level ranges and provide an action plan for hyperglycemia, including diabetes ketoacidosis prevention. Review the need for extra fluids, correction with extra insulin by direction of the healthcare team, and ask your child to be sure and let the supervising adults know if they have any abdominal pain, nausea, or fever, which can possibly lead to elevated blood sugar levels and diabetic ketoacidosis risk. The preschool years, it pretty much goes without saying that appetite may be quite erratic. So it's often a great idea for children in these years with diabetes or even without diabetes to offer a routine of eating with some choices. Help preschool children. During the preschool years, the appetite may be quite erratic. Offer a routine of eating with some choices. Help the preschool child learn how to identify low blood sugar levels, such as making sure they let the supervising adult know that they're not feeling well. Again, this is something to practice at home as best as possible. And again, we do know that variability in eating patterns are quite normal. So it is a challenge to have blood sugar control during the preschool years, but routine and communication is key. During the elementary school years, these are more predictable years because of supervision elementary school years, this is somewhat predictable. Supervision is routine in kindergarten through 5th or 6th grade. Promote developmentally appropriate independence for shared tasks, such as monitoring, snacks, and insulin injections. Plan for special events to promote independence and minimize differences, and ensure access to fast-acting carbohydrate and snack and glucose tablets and gels to treat low blood sugar. During the teen years, this is another challenging time. Ask diabetes care team members to discuss with your teen the effects of alcohol, cigarettes, vaping, and even energy drinks and drugs on diabetes. Discuss peer pressure. Share ways you handled these kinds of issues as a teen. Listen closely. It's very, very important to not just tell your teen what to do, but listen carefully to their answers. Also watch and observe their mannerisms, their change in diet, their change in routine or sleep patterns to see if there's any other concerns going on. Remind teens to always carry diabetes supplies, wear a medical ID bracelet or necklace, include medical and health information on their cell phones. When offered cigarettes or alcohol, review ways to politely decline. This again takes some role playing sometimes to help them gain a comfort level. Especially review the issue of drinking and driving, because again, this is a critical time in teen life where there's lots of risk, and review with them the fact that alcohol can unpredictably create hypoglycemia in a severe manner because of the way alcohol is used by the liver. So be especially careful to communicate this risk with your teen. So during the teen years, again, food and meal choices may be irregular and erratic. There is a range of nutrition needs depending on growth, development, athletics, and socialization. Be aware of influences on food choices, body image, hunger, and appetite. Again, pay close attention to any significant changes in appetite, eating patterns, not just what they eat, but how they eat. Are they eating by themselves? Are they eating in the room? These are clues to possibly other significant medical or psychological issues. Hormonal changes can significantly impact blood sugar control, even with the best of care. During puberty, there's many growth hormones that kick into high gear, which can significantly change the need for insulin dosing. So discussing again with the healthcare team how to adjust for changes in hormone levels, menstruation influences, as well as growth and activity needs. And again, review driving safety, including the need for blood sugar checks before and after any driving events, and availability of hypoglycemia treatment in the car as well as right on their person. Are there laws that protect my child during field trips and extracurricular activities? There are 3 federal laws that protect students with disabilities, including diabetes, from discrimination. First, there's the Section 504 of the Rehabilitation Act of 1973. There's the American with Disabilities Act and the Individuals with Disabilities Education Act. Under these laws, diabetes is considered to be a disability, and it is illegal for schools and child care providers to discriminate against children with disabilities. These laws help make sure that children and students, Under these laws, diabetes is considered to be a disability, and it is illegal for schools and child care providers to discriminate against children with disabilities. These laws help make sure that students with disabilities get the care they need, receive fair treatment, and are given the chance to take part in field trips and extracurricular activities. State laws may provide additional protections. The required accommodations should be documented in a written plan, such as the Section 504 plan or Individualized Education Program. Other important resources for support include the American Diabetes Association Safe at School website, the Center for Disease Control and Prevention Managing Diabetes at School website, Children with Diabetes at School site, Juvenile Diabetes Research Foundation, they have a school advisory toolkit, type1nation.org, and the National Diabetes Education Program, Diabetes Resources for Schools and Youth. There's a variety of sources at this point in time on different very useful websites to help support you and your children. I'd like to see if there's any questions today, and I want to thank you for attending today's webinar. Please reach out to us with additional questions or if there's a topic you'd like us to cover during a future webinar. You can contact our Solara Certified Diabetes Educator at solaracde@solaramedicalsupplies.com.